community health outreach program. And that works by training peer educators to hold workshops which educate communities about things like communicable diseases, family planning, reproductive health, etc. And a little off branch from CHOP is GROW, which stands for Grassroots On-Site Work, and it's an internship that some of our Globe Metters take each year. And yeah, typically they actually go to Thailand and do some work with CHOP on site, but now it's like virtual because of COVID. So yeah. Other programs that SAW coordinates include the Healthcare House, which is a place for women and children with HIV/AIDS to live and get treatment. The Migrant Learning Center and the SAW School, which, as the name suggests, they educate migrant children, typically from Burma. The Children's Crisis Center, which provides shelter, protection, and basic needs for youth who have survived violence or abuse. The Safe House, which provides shelter and basic needs for orphaned and abandoned children. And the Boarding House, which provides migrant children with housing and education. Okay, so there are a couple direct effects of COVID, including trouble placing people who have COVID because the hospitals are full and they keep getting more full, even though, and like they are in their second wave, although ATL, our primary contact at SAW, says it's not like as bad there as it is here per se. And then contact tracing is also a struggle because there's not very good coordination between ministries, so it's hard to make sure everyone's accounted for. And then also, SAW itself is mostly quarantined, because of like shelter in place and like not wanting to spread COVID-19. Okay, so those are the direct consequences of COVID, over there, but there are also a lot of indirect consequences which are debatably more impactful. So one of them is stronger border regulations, in order to like control the spread. Every friendship bridge and boat is closed, and illegal ways of crossing the border are being watched more closely. Soldiers have extra power to stop crossings, including shooting on sight. So obviously that's a huge problem for people trying to get to Thailand in order to make a better life for themselves. Another huge problem is starvation because people aren't getting wages since like jobs aren't as readily available due to COVID. So you can't afford to pay for food, and also the lockdown is so tight that it's hard to get physical access. And so nutrition problems are becoming more prevalent, especially in migrant areas. Going off of that, stealing and other crimes are going up because, like, you need to get food somehow. Another big problem is access to clean water and sanitation. ATL works for an organization that's trying to provide clean water to communities in Popra, but they couldn't get in because of like the restrictions on and lack of trust like surrounding not wanting to get COVID. They're working to get like a purifier to make water drinkable, but like the budget is limited. So that's an issue. And then like for most of the people, like they can't afford to buy clean drinking water because of the lack of regular income due to COVID. Another issue is the lack of education because most education is suspended, even for university and migrant schools due to COVID. SAW's Migrant Learning Center is open because they report to the local municipality and authority about how many students they have, and all of the students come from their shelters versus the general public. So like they're not as concerned about like transmitting COVID. However, police and state officials have come to observe the learning center and they have to follow procedures really closely. This also may be the final class of students due to funding difficulties, so like they have a lot of pressure to do well this year. And a kind of note off of that, students who have passed the matriculation exam would normally go back to Burma, but they can't because of COVID, so they're kind of just stuck there. Another aspect of education involves CHOP, and the CHOP workshops had to cancel for a while. They've started resuming now, but they're limited to 20 to 25 people, and the smaller size limits the kinds of activities they can do, and they also have to follow like procedures really closely, just like the migrant learning centers. And then last but not least, there's transportation difficulties, obviously, because trying to stop the spread. And women especially face these difficulties, especially if they're pregnant. Okay, so going back to our little diagram, I was going to talk a little bit about how each of these are impacted. So first is Grow, and it's been moved online, and this year and thinking about next year, and we're going to do great things with that, but it's been a little like different than we expected. CHOP, as I just mentioned, had to be like postponed for a while, but now they're resuming at limited capacity. The healthcare house is quarantined. The migrant learning center like also is quarantined, and like as I said, they are like functioning, but like they still have to follow a lot of restrictions. And then the safe house, the children's crisis center, and the boarding house are all quarantined as well.
Okay. Thank you, Julie Grace, for presenting about what we have heard from SAW about their response to COVID-19. With all the challenges that they have faced, we wanted to emphasize today that our partnership still continues, even though the GROW team wasn't able to go in person to meet SAW and to perform work on the ground. We could still perform work virtually and build connections with SAW staff, SAW beneficiaries. You can see a picture here of English conversation sessions, which we'll touch on in a little bit. So the key to our virtual GROW internship this past summer was the communication we had with ATL, or Ong Tun Lin. He's our primary contact at SAW, and he communicated with us weekly. Typically after our English conversation session, we would meet with ATL, brainstorm what the next week's topics would be like, and take pictures at the end of our video calls in which Noah would more often than not be ready for the photo. As a team of GROW interns and with other chapter members, we met weekly to design those lesson plans. And I put lesson plans in air quotes because we aren't English teachers. We aren't trained to be teaching the content. Also, SAW students are in English classes at the schools they attend. So really our sessions were designed for practicing their presentation skills, and you'll see kind of the idea that we were going for with these are having SAW students prepare presentations. We would assign them some sort of topic, like a biography of a famous person, or what do you want to be when you grow up? If you could travel to a certain country and sell us on it, what would that country be like? We had a few requirements, and we were amazed to see the types of PowerPoints that they put together, the presentations that they gave us, and their responses to our questions, which we thought was a great way of practicing English with them, something that we typically do on the ground, but we adapted to doing so virtually. Some of the famous people that they chose include Little Peep, who I feel like I'm an expert on after discovering him for the first time. More recently, we have met with ATL and our chapter coach Najma to discuss the annual action framework. The AAF is this year's version of the PAF, which is a document that we write every year in collaboration with SAW during the GROW internship. So of course, because we weren't able to be there in person, we had this meeting online and discussed our goals for this upcoming year, what went well in terms of our partnership, what do we still want to work on going forward. The AAF is actually a document that applies for chapter as well. And our coach, Najma, is going to be at our e-board meeting tonight to talk with our e-board members about the goals we've set for our chapter side of this AAF. Okay, back on topic here. The AAF is what we refer to when SAW is looking at the programs or initiatives that they want to run with CHOP for this next year. It's also where we communicated honestly about our fundraising goals. Typically, the PAF and in a normal year, GlobeMed at UC would strive to raise $10,000 in order to fund the CHOP program. This year, we had this conversation with ATL and let them know that we are more realistically going to reach a $6,000 or $8,000 fundraising goal. And so communicating that with our partner is important so that they are able to plan for and budget and take that into account when they're designing their programs for next year. Okay, I'll end with a bit of reflection on how our partnership in particular with SAW, where it had strengths and where it had room to grow. In terms of strengths, we communicated very frequently with ATL, at least weekly, and again during that time when we were holding English sessions with students at SAW. This is a strength because it ensures that another generation of Grow interns know who ATL is, can work with him, and also are maintaining connections with the students at SAW. Back home, or with the new e-board that we were entrusted with over the Summer of Action campaign was a tremendous success in using our social media and our campaigns, e-board members to sell items and raise awareness during that campaign. And then finally, more recently, that AAF conversation where, again, facilitated with Najma, we had honest and transparent conversations with ATL where he let us know what his future looked like. We let him know about what GloMed can contribute to our partnership going forward. And we talked a lot about places where our partnership can grow. So in terms of challenges that we had over the summer with the virtual partnership, not being there in person to see documents, to witness a CHOP workshop is a real hamper on some of the projects that we plan to do on a GROW trip. Monitoring and evaluation of CHOP workshops is pretty much the essential purpose of a GROW internship, but there are other projects that we try to complete. So this leads us to where can we grow in the future? We know and are anticipating a virtual internship for 2021. So we know that there are a few project ideas in which we want to publish SAW's new website, look at their social media platforms. So these are all places that we've identified as places to grow our partnership. Okay, so that brings us to the end of discussing SAW, their response to COVID-19. Before we move on to the next sections, I wanted to take a moment here. Does anybody have any questions? If you want to throw it into the chat and we can respond to it, or raise your hand or something you have a question about.